Get started momentarily. Thank you. Welcome, everyone. Give us a few more moments to make sure that all families have had a chance to log in, and then we'll get started momentarily. Hi, everybody. Give us a few more moments to make sure that all families have been able to log in, and we'll get started. Hello, all. My name is Reggie Lunagakid, and I want to welcome you to tonight's second webinar in our Summer 2021 Family Webinar Series. Tonight, I am joined by colleagues in the Habif Health and Wellness Center. We will introduce them shortly. We are so excited that you've chosen to join us for tonight's conversation. Some information before we get started. First, we want to make sure that you know how to submit questions during this webinar. You will notice that we've given you the ability to ask questions via the Q&A feature. 3 of our professional staff within the First Year Center are helping to field these questions. We will answer those that we find applicable to the audience as a whole on this webinar, and we'll respond to more nuanced or personal questions via email next week. Let's go ahead and make sure you know how to use the Q&A feature. Using the Q&A feature, go ahead and share the place that you're watching from, and we will name some of these places on air. Secondly, we will be showing a PowerPoint created by our panelists during tonight's webinar. However, if you prefer to download this PowerPoint and follow along on your own, please follow the link that is just shared in the chat. As a note, in the chat, we will be sharing links and email addresses throughout the duration of the webinar. Third, this webinar is being recorded live. Later this week, we will upload this webinar to the families.woostel.edu website. Lastly, in a moment, we will hear from our 3 panelists about the services provided by Habif. If something they say sparks a question, don't forget to send it to us using the Q&A feature. After hearing from our panelists, we will move on to the Q&A portion of the evening. Before passing things along, I want to share some of the places people are joining us from. We have families tuning in from Buffalo, Illinois, New York City, Chicago, among many other places. Now, since I know you all want to hear more about Habif Health and Wellness, I will turn it over to our panelists for introductions and the sharing of their content.
Hi, good evening. My name is Aaron Daughtery. I am the Associate Director of Administration at Habif Health and Wellness. I'm excited to share some information with you all about the services we offer at Habif. I'll be back in just a moment to share some of that info before we move into the Q&A, but I will hand this to my colleague, Dr. Tom Brounk.
Good evening. I'm Dr. Tom Brounk. I'm Director of Mental Health Services here at the Habif Health and Wellness Center. I am the Director of Mental Health Services, which means that I have responsibility for both counseling and psychiatry services here at the university. We're comprised of, on the mental health side, 13 counseling staff and 5 psychiatric staff. So we are well equipped to respond to the needs of our students, in addition to a very much qualified support staff.
Hello, everyone. I'm Cheri LeBlanc. I'm the Executive Director of Habif. Habif is an integrated health center. So Tom and his mental health folks report up to me, as does the medical department and our health promotion department. I'm going to let Aaron tell you all about our services, and I'm happy to answer questions afterwards.
Great, thank you, Dr. LeBlanc and Dr. Brounk. Just to kind of start off to give you a little just general information about Habif and what we are able to offer to your students while they are with us at WashU in St. Louis. We are a comprehensive and integrated health center, meaning that we provide medical, mental health, and health and wellness promotion, all three of those departments reporting through Dr. LeBlanc. We're located on the South 40, which those of you who have not had a chance to visit the campus yet, that is the portion of the campus where all of our first-year students live. We are in the lower level of the Daughtery house. So if any of your students happen to be placed or live in the Daughtery house, they'll be able to just hop on an elevator and come right down into our lobby. But for students in the other buildings, we are conveniently located within walking distance, very close to all of the residential halls. We are open Monday through Thursday from 8 a.m. to 6 p.m. and Fridays from 9 a.m. to 5 p.m. Closed for all university holidays. We have some shortened hours during winter breaks and spring breaks. After hours, when we are closed, we do have our nurse advice line and mental health crisis support that are available by calling our main number, and then you can get redirected to one of those services. Within the medical services, we provide routine and urgent care, women's health, and travel medicine. Dr. LeBlanc, who you've already met, is a medical doctor and executive director of Habif and a board certified family physician. We have 4 additional medical doctors that are all board certified in one or more areas of internal medicine, family medicine, pediatrics, or emergency medicine. We do have a nurse practitioner dedicated to women's health and 2 physician assistants, as well as 5 registered nurses and 4 medical assistants supporting their work. In addition, we have a radiology department that's able to provide basic diagnostics that are then read by board certified WashU radiologists. So if a student sprains an ankle skateboarding on campus, or maybe has some respiratory symptoms and needs a chest x-ray, we are able to do that right there at Habif Health and Wellness on the South 40. In addition, we also have a full service pharmacy that fills prescriptions written by our medical providers. Within Habif, we are also able to provide that from outside providers. So even your family physician back home would be able to call prescriptions into that pharmacy. On the mental health side, as Dr. Brounk said, he is the director of mental health service. He is a licensed psychologist. So updates to this, we have 13 additional therapists with psychologists, counselors, and clinical social workers. And we actually currently have 5 medical doctors that are board certified in psychiatry. We were able to recently add one of our WashU Med Campus psychiatrists that's joining us for a few days a week. So I'm able to increase psychiatry services for the fall. In addition, we have a care manager that supports our students that need more ongoing and long-term support by accessing mental health services on both on campus and in the community. The range of services provided by our counselors and therapists at Habif includes short-term individual and couples counseling, group counseling, both of a psychoeducational and therapeutic nature, and psychotropic medication management through our psychiatry services. And then our third department is our health and wellness promotion. This is staffed by 3 professionals with a variety of education and backgrounds. They organize events across campus related to healthy eating and sleep habits, mental health, mindfulness, healthy relationships, sexual health, alcohol and other drug abuse prevention, and substance abuse recovery. So all the things that your student needs to kind of, as they're beginning to take over some of their own healthcare and some of, maturing in that way, information that they need to make good decisions about their bodies and about their health. Some important requirements to note. All incoming first-year students are required to have a list of certain vaccinations that we do require on campus. We require 2 MMR vaccines that have taken place after the age of 1, meningococcal vaccine or meningitis after the 16th birthday. For our students that are coming to us from countries that are defined as high risk for tuberculosis by the CDC, we do require a TB test within 6 months. We do now, in the last 2 years, have begun requiring influenza vaccination that has to be done between August 1st and November 1st, and we will be providing those on campus as we have for many years. So your student doesn't have to worry about trying to get that done before they move to St. Louis. We'll have many opportunities for them to receive their flu shot on campus. And then obviously, of course, new this year, we have COVID vaccination is required prior to campus arrival. I'm sure there'll be some questions about that as we move forward. But just in general, any vaccine that has been approved by the World Health Organization does meet that requirement. Additionally, we have some recommended vaccines that are not required, but a good idea when you're moving into a communal living setting like we are, the meningitis B vaccine, tetanus, hepatitis A and B, HPV, or varicella, the chickenpox vaccine. and those all can be accessed at Habif Student Health. All of that information, the student's vaccine information as well, their health history form, does need to be completed through our student portal by July 15th. We'll be reviewing compliance on that between July 15th and August 1st, just to make sure everybody is all set and ready to move in, which I believe starts August 19th. In addition to the immunization, another requirement that will be of concern for our first year families is that we do require that all of our students have health insurance that meets the university's policies for minimum coverage. All students are automatically enrolled in our student health insurance plan, but they do have the option to waive out of that plan as long as your family's insurance meets all of those requirements. Those can be found on our website, and I think they'll be posting that link in the chat for our student health website. But our student health plan that we do provide is a United Healthcare Student Resources Plan. So that has access to the entire United Healthcare network, international coverage. So even when your students are back home for breaks, that insurance will stay with them and they can use that wherever they are. The 2021-22 premiums are $1,942 a year that is applied to the student account for those students that do not waive out. And it's effective from August 1st of this year through July 31st of next year. So it's a full annual plan. Some information about that insurance plan. The copays are $25 for doctor visits, but only $10 when visiting one of our providers at Habif. Urgent care copays are $45, but again, because at Habif, even though we provide urgent care, we typically bill it as routine medicine, so it would only be a $10 copay at Habif. There is a $350 deductible, but that is completely waived at Habif. And then after the deductible is met, there is an 80% co-insurance. Within the pharmacy, copays are $20, $45, and $75, depending on the level of the prescription. Our plan is fully compliant with all ACA requirements. One point to note that if your student is utilizing the student health insurance plan, they are required to use Habif for their primary care, and then they would receive a referral for specialty care outside of Habif. This is waived in certain situations. So for instance, if they need emergency care or if they need urgent care when we are closed, they don't have to get that referral first. Any OB/GYN services or mental health care also does not require a referral. And like I said, their insurance works when they are back home with you in St. Louis or back home with you outside of St. Louis. If they're more than 50 miles away from campus, no referral is required. Just in general HIPAA information. So Habif is a HIPAA covered entity. All our doctors are credentialed through the Washington University Physicians Network. So that obviously, as a healthcare provider, we are required to maintain HIPAA coverage. So we cannot share information about students' records without their explicit consent, or in the case of emergencies. So sometimes we will have parents try, want to contact us to get information about their students' health records without their students' explicit consent in written form. We're not able to release that, but we do have HIPAA release forms available on our website. Those must be signed by the student in person, and they have to be renewed every 6 months. And then of course, under HIPAA law, students that are 18 or older do have the right to revoke that consent when they choose to. We are also in compliance with the National Cures Act, which provides students access to their digital medical records. So students will have access to our student health portal where they can schedule appointments, get contact with their providers, and they also through that website will be able to access all of their digital medical record. All right, and then finally, and we can move into some question and answer, is some of the fees that will be collected. So we have a health and wellness fee. You're talking about the student health insurance for those students that do not waive out. And in addition to that, the Student Affairs Division has implements the health and wellness fee to support our work at Habif, as well as Summers Recreation, the RSVP Center, and Disability Resources. For the 2021-22 year, that has been set at $269 per semester. And just to give you a little bit of idea of what that might support at Habif, much of our health and wellness promotion activities, we have the Zenker Wellness Suite at the Summers Recreation Center, where students can get access to information about wellness and healthcare, and a limited number of counseling sessions for every student is included within that fee as well. And I believe that concludes our general information, and now we are very excited to open up for some questions.
Thank you so much, Aaron, for sharing that information. I have an initial question that I know many families may be wondering. How can families encourage their students to take advantage of Habif's many resources?
Well, it is a great question. And as a parent of college-age students, it is really hard to get our students to listen to us as parents, right? I think I would just be sure if you know of our resources, to encourage them to call us. If they're calling you in the middle of a time that they're in crisis or worried or sick and they don't know what to do, encouraging them to get, you've got a resource right there, call them, try and see if you can be seen. I can't tell you how many times I told my son or daughter at their own colleges, I'm your mother, not your doctor, and you need to call student health. So I guess that's what I would say. I don't know if the other panelists have any other comments. Tom, you're muted if you're talking.
I would just add that it's pretty natural at this point in time, where your students are trying to figure out, well, how much do I need to take responsibility for myself, and how much can my parents still help me with? And that can be a really sort of transitional, challenging time. So I think to normalize right now that this is an opportunity for them to begin to get their feet wet with learning a little bit more about what insurance is, how it works, what happens when you go to a doctor, the things that you could have been taking care of automatically, they're going to need to learn. And this is as good as a time as any to begin to maybe try to take a little bit of a step back, see how they do, check in with them about, were they able to make the appointment? Do they experience any kind of difficulties? Some hand holding may still be very much appropriate, but rather than maybe you jumping in right away, just offering suggestions and see how they do with those.
Awesome, thank you. We will now move on to the remainder of our question and answer portion of this webinar. As a reminder, please submit your questions via the Q&A feature at the bottom of the screen. Our first question, are there campus support groups that are facilitated by the Habif Health and Wellness Center that focus on different aspects of mental health?
I'll go ahead and take that one. There absolutely are. And there's actually quite a few, depending on what your student might be looking for. We offer actually several versions of a program called Doing Better Today. That is really for any student that in one way, shape, or form want to work on developing some skills for either managing anxiety, coping with some distress, figuring out maybe how to be more assertive in their relationships, or maybe they're having some difficulty with making connections. Doing Better Today is really a skill-based group of probably about 10 to 15 students. We run at least 3 to 4 different sessions of this each semester, so it is quite popular as our group program is concerned. But we also offer groups focused specifically just on managing anxiety, what we call interpersonal process groups. So those are really groups for students just wanting in some way, shape, or form to improve how they connect with others, setting appropriate, healthy kinds of boundaries, how to make those connections, taking some risks. Groups for our international students, just to really gather and connect and talk about some of the unique experiences with being an international student. For our LGBTQ plus students, a group called Lavender Circle. This past semester, no surprise, we ran a group about connecting in isolation during COVID. Then also groups to work on family issues and just general transition. So every semester it changes, but it's usually 10 to 12 groups.
Thank you. Aaron, we're getting a number of questions regarding health insurance waivers. So can you remind families of the deadline for waiving the student health insurance plan and how a student might be able to access that waiver?
Yeah, absolutely. So the health insurance waiver period will open on July 1st and be available through the end of the day on September 5th. Students will access that through their WebStack account. And we have some pretty detailed instructions about the waiver process on our website, and that link should be getting posted here in the chat. So you can check that out. A big piece of that is you're planning on waiving. All the criteria for your family insurance is listed there, and you'll want to make sure it meets those requirements to be approved for a waiver. One piece of that often comes up is whether or not your insurance is considered in-network for both Washington University Physicians Network and at Barnes-Jewish Hospital, our partner hospital. And that's key because when your students are in St. Louis, we want to make sure that they don't run into a major medical expense, that they're able to access services at Habif without being billed as out of network and an expense that might derail their college plans. So there'll also be a link shared of all of the insurances that are considered in network with Washington University Physicians Network. So you can check that and see if your insurance is there. And another option is just to call your insurance and provide them our tax ID number. And I was searching through my email to the side here, and I do not have that. It's on a sticky note on my desk at my work office, and I'm at my home office today. So we'll try to get that out to anybody, but you can reach out to our studentinsurance@woostel.edu email address, and we can get you that tax ID number. You can provide that to your insurance, and they can usually use that to see if we're in network or not. So that's a big piece of it. If there's any other questions about waiver, more than happy to respond to those. I think that captured most of it with that, and on our website, most of that information should help you out.
Great, thank you so much. Dr. LeBlanc, what resources are available for students' reproductive health? Can they receive birth control or STD or STI testing here at Habif?
Absolutely. That's a big part of what we do. So, and again, as parents, you may not want to hear that, that there's a lot of sex that goes on in college, and we deal with that a lot. In fact, it's one of the things that we really encourage our students to come to us with any concern that they might have. And so we really try and make sure students are really know what our resources are, but we have a wonderful nurse practitioner, who is trained just in women's health. We have all of our physicians and physician assistants are very up to date on STIs, contraception, and really, passionate about it. So it's a great resource for your students.
To change gears a little bit, we have some questions regarding medical forms. Are there any medical forms that need to be filled out directly by a physician at home before arrival, in addition to the health history form?
I can take that, and no, they're not. So everything you'll need to complete is done on our student portal, the health history form there. I did think I saw a question in the chat about a form that a doctor would need to fill out. We don't require any paperwork from your family physician other than your immunization records. So you'll do the health history form based off the information that you know. Your immunization records you will upload so we can verify those, but there are no other health forms that are required.
If students are unable to find an appointment through Habif, is Habif staff able to refer a student to a local doctor or therapist?
Certainly, on the medical side, there shouldn't be very, very much difficulty at all getting an appointment with any of our staff, but we also certainly look to refer to students to specialists in the area or other folks that wouldn't be needed. Tom, I'd have you respond for mental health. Thanks.
Yeah, on the mental health side, we have someone called a care manager. Her name is Missy Showalter. And she will assist students with finding a connection in the community. Maybe it's a specialty that we don't offer at the Habif Health and Wellness Center, or they're looking to be able to meet regularly on a weekly basis with a therapist, throughout the academic year. They really are just wanting a more private, off-campus type of experience or setting. Those all might be reasons why Missy could be very helpful. And also online, on our referral part of our website, we have a webpage just devoted to assisting students with finding resources. They can actually go to our website, put in their insurance carrier, put in that they want to talk to a female therapist about relationship issues, and it will actually give out names of WashU connected therapists that we've worked with quite often in the past, and we know have a good reputation amongst our students.
Thank you. Speaking of referrals and sort of knowing your students, is there a process for parent and family members to anonymously refer their student to a Habif Health professional if they have some concern about their student's well-being?
That's a good question. I'm trying to think of the best way to answer that, and I might look at Tom as well. But I think to come and see us, we really want students to want to come and see us, and any parent can call and tell us their concerns. We don't then do outreach on their behalf to the student. We ask you as a parent to tell your students of the resources and to encourage them to call us. I think that was the gist of the question, Reggie. But I want Tom to maybe say a few words as well.
Yeah, I think I'm just a little bit hung up on anonymously referring. Certainly, a parent can call us and provide information to us. We're always glad to listen. We don't have to tell the student that you've called unless it really is a situation in which you're sharing critical information regarding the safety of your son or daughter. But in many cases, we will listen and take the information in. The other issue that relates to referrals that it might be worth mentioning is that, sometimes, you may think that it would be helpful for your son or daughter to talk to a psychiatrist or talk to a mental health professional, but they're not yet ready to make that step. What I can suggest to you is maybe trying what I call the backdoor approach. And if your son or daughter is experiencing some sort of difficulty with maybe some other health related issue, maybe it's their diet, or it's they're having headaches, or having stomach issues, you could suggest a referral to one of our physicians, or maybe our dietitian, somebody that perhaps they may feel there's less of a barrier in talking to that individual. And as long as we know that you're thinking that actually talking to a therapist might be helpful, if that clinician isn't already making that referral, we can put a bug in that clinician's ear and say, hey, we got a call from the parent. It might be worth at least mentioning to the student about our services. And then once they're here, it doesn't feel quite as threatening or intimidating.
Thank you so much. To shift gears a little bit, Aaron had mentioned a little bit about the educational opportunities that Habif provides. What options does Habif have for students to become educated around safe drinking habits or alcohol consumption?
Yeah, that's another great question, Reggie, because we all know there's no drinking during college time either. So there's a couple of things. One is your student will be asked to complete a course before coming, which is really an educational harms reduction based course on safe consumption of alcohol or other drugs. And that is a requirement that needs to be done. I believe it is launched near the beginning of August each year. So your student will have about 3 to 4 weeks to complete it. We also have one of the staff in our health promotion department who is our assistant director for alcohol and other drug programming. And she, along with many of our peer health educators, and these are undergraduate students of WashU, well, they did it virtually all last year, but they often will have educational seminars or programs, sometimes in the residence halls, sometimes in different areas around campus, talking about these very issues and how to stay safe.
Can an out-of-state doctor prescribe medication that is able to be fulfilled at Habif's pharmacy, or does it need to be a doctor practicing here in St. Louis?
I believe that the pharmacy will accept prescriptions from anyone. There may be some limitations on controlled substances, but I believe that, again, most of these are done by electronic prescribing, and there are ways to do that. Aaron, you may have a little more information about the pharmacy itself, but in general, it does not need to be our physicians at Habif or even a physician here at in St. Louis.
Yeah, I'll need to follow up by pharmacist. I'm not a pharmacist, nor have I ever played one on TV. So I know there are some regulations around that about where you're licensed as a physician and whether you're able to cross state lines with prescribing. So we can get that answer and get that out to the participants today, but I don't have that right at the moment. But I want to make sure I don't give out any bad info. So let me check on that.
So we recognize that COVID-19 has had a large impact on our students' lives and their mental health, their feelings of isolation, et cetera. Are there resources that have been developed to target some of these issues or adjusted to target some of these issues?
Reggie, I just had a little trouble hearing the very first part of your question. Would you mind repeating it?
Yeah, for sure. So we recognize that COVID-19 has had a large impact on our students' lives and their mental health, their feelings of isolation. Are there any resources that have been created or adjusted to better address some of these new issues and needs?
And I'm going to turn to Dr. Brounk to start with that one.
Yeah, so within the University Counseling Center world, there's lots of discussion about what is this next semester going to bring. Across the country, it was interesting. Certainly we had local types of fluctuations, but generally, surprisingly, there was a reduction in the utilization of mental health services within University Counseling Centers across the country, anywhere from about 20 to 35%. So I don't know what this upcoming semester is going to look like. We're thinking that we're going to begin to see significant types of increases. People that delayed treatment that for one reason or another just were zoomed out and didn't feel like they had the wherewithal for yet another Zoom meeting. So those students could start showing up. And so we are continuing to add staff to the counseling center here at WashU. We've already added 2 for this upcoming semester, and hopefully we'll be adding more. We're also, this might be a good time to just mention that after hours, if a student is particularly experiencing some panic or distress around an exam, around whatever the trigger is, we offer after hours our support line, which is answered by mental health professionals right here in St. Louis. We have a wonderful resource actually just down the street called Provident Behavioral Health. They actually answer the crisis line for the state of Missouri. So these are very well trained professionals, and we have a close working relationship with them. So a student can just pick up the phone after hours and dial our main number and be connected with a counselor. We're also looking at adding something called one session at a time options for students, so that a student may not really feel ready, to begin a full course of counseling, but what they really want to do is just come in and talk to a counselor maybe once or twice on a focused issue. So we're going to be adding that as actually augmenting what we're already doing with a program called Let's Talk. So those are just some beginning ideas, but ways to help students connect is really the issue here. And it's not just the counseling center that is focused on this. We have good, strong working relationship with our residential life team, and are very much involved with the training of those resident assistants.
What a good segue. Dr. Brounk, we also had some additional questions about, are there other resources that parents should be aware of that are available on campus besides Habif for their students who may be struggling with feelings of isolation or mental health?
So I already mentioned the after-hour support line. Let's Talk is that program that's about a drop-in, like a one-time, it's only a 20-minute type of offering, much like maybe office hours with your professor. Uncle Joe's is our student-run peer support group on campus. So those can be students that are well-versed in what we have to offer, well-trained in active listening, can support students through a number of stressors. They see the service though as a one-time offering. So it's really more than just a one type of visit. They're going to make a referral, most likely to the Habif Health and Wellness Center. We have a group called Active Minds on campus, which is there focused on really just outreach, destigmatization around mental health issues. So that could be a really neat kind of opportunity for a student to get involved with, that if they have some more sort of advocacy types of interest. But it's also worth mentioning that our Office for Religious, Ethical, and Spiritual Life, that is a very close campus partner, does not use the word chaplain in the title. This is really somebody that is available to all students, regardless of their thoughts or beliefs. We'll speak with a number of our students that are non-denominational, do not even have a belief in a higher power. So that's also an option. So quite a well-versed network.
Thank you. If a student needs a general wellness visit, are they able to do that at Habif? And extending on this question, what about some more complex health issues? Is that something that you would recommend them see folks at Habif for?
Yes and yes is the short answer to that. No, we encourage students to come and see us for whatever it is that they're concerned about. And if it's just a wellness check, they want to be sure they're healthy, that they may have some questions about their health. We certainly have availability with appointments for that. For the medical side, we do encourage students to book appointments, and we have same day appointments. They're really next day appointments. They open up all night long. So if a student has any kind of concern, the odds are pretty high that they're going to be able to find an appointment within a day or so that's going to meet their needs. We have some really excellent internists on our staff who really do handle quite a number of complex medical issues. So I would encourage you to have your students start with us. If our physicians feel that this is such a subspecialty area that we really do need to refer to our colleagues at BJH or on the med campus, we will do that. We work closely with them. But I just have to say I've worked at a lot of institutions over my career, and I am just super proud of our medical staff. I think they're really incredibly well trained and really passionate about student health.
If students are away from home this summer for, say, summer camp or study abroad or some other opportunities, are families able to submit their health insurance waiver request on their behalf? Or do you have other advice for how these students should be able to proceed?
I'll answer that question. So if you have access to your student's WebStack login and password, which frankly, we don't recommend sharing that information, but if you have that, you would certainly be able to log in and complete that waiver on their behalf. But a more practical solution might be to email our student insurance at woostel.edu, explain to them that your student is away, that you aren't able to access the waiver portal, and we can do that manually for you. They'll just collect that information from you via email and submit that on your behalf. So we can certainly take care of that. Easiest way is just email student insurance at woostel.edu.
Can a student use WashU's student insurance as well as their family's insurance at the same time? Are there advantages or disadvantages to one versus the other?
Certainly, we've had several families that utilize that. Typically, the way the policy is written, the student health plan will be their primary coverage, and your family plan would be secondary. So that would pick up and cover deductibles and co-insurance and things of that nature. You do want to contact your insurance provider and ensure that they participate in continuity of care. There's a whole process between insurance companies where they kind of negotiate who takes what part. So you just want to make sure that they cooperate with that. But as long as they do so, we've had many families find it to be advantageous to carry both coverages.
Reggie, I would just add that if there are resources to consider purchasing, if you have both your own private insurance, but also consider purchasing the university health insurance. I can tell you on the mental health side that students, once they reach the point where their free sessions that are available to them are fully utilized, knowing that they can seek off-campus support without their parent knowing comes up more times than I care to mention. And if the student, one great benefit is if you purchase the plan for your student, the university plan, then your student is the owner of that plan. And the explanation of benefits will go directly to them. If that latitude is something that you think your son or daughter could benefit from, and there is the potential to that resource being available, that can make a difference.
Is there generally a wait list for students to be able to access a mental health counselor?
So at Habif, we don't work off of a wait list for that first visit. So the very first visit, which we're trying to get a sense of, what's going on, how quickly do we need to respond to that student. There's usually, they can schedule that within a day online 24/7, and they'll be seen within 2 or 3 days. Where we begin to see the waits beginning to increase would be for those return visits, for their second and third appointments. Those will, as the semester progresses, and we're talking about moving into the month of November, when the caseloads are full, then it can end up being a couple weeks. We don't like it to be more than that, but it can get longer. So this is where the walk-in counseling option that I mentioned earlier can really come in handy. The Let's Talk options. We all actually do offer something called TAO, which stands for Therapist Assistance Online. So that is a self-directed program for low to moderate anxiety and depression. And of course, we can also look at trying to help a student get access into the nearby campus offerings as well.
Thank you so much. We are going to ask one last question for the evening. As a reminder, any questions that we were not able to answer during this webinar will be addressed via email directly to the person who posed the question. Panelists, thank you so much for the information you've shared tonight. What advice do you have for families in terms of supporting their students' health from afar?
I guess I would repeat some of what I had said earlier, having been on both sides of this coin, raised three children. My youngest now a senior, so soon will be done with college. And I would say, gosh, it's really good to have conversations with your son or daughter before they come, talking about some of the important issues that they may face. The question about alcohol use and how to do that safely, talking about difficult issues like sexual assault and how does, what can you do as a student to be an active bystander in a situation like that, or to be sure that they know the resources. And I think the one thing that I think I was given advice when I first, reached that parent sending my kid off to college is that often students just want to lay their problems at your feet, right? They don't necessarily are expecting you to solve them all, though you may. That's what the thought is, and that you want to jump in and fix everything, but often just allowing them to talk and being that active listener and supporting them, because this is going to be a tough time. It's a tough time. College is always a tough time, and I think we forget that because it's been a while since we were in college, and college is very different than it was when we were there. So I think that being that active listener, showing some empathy to your son or daughter about what they're going through, reminding them that there are many resources on campus, and that includes, especially for our first year folks, there are RAs, the folks in residential life that are there and available as a listening ear. And I think I'll stop, or I could keep on going for a long time and let some of my other panelists jump in.
Yeah, thank you. I don't have so much. I think those were all great suggestions. I don't have anything really specific to say, except more about the approach that I think will be more likely to be received. If you have suggestions or ideas, that is, don't enter into the conversation expecting that your student is going to go do exactly what it is that you're recommending that they do. I think that's a setup for you as the parent to end up feeling frustrated, and for there to be friction that can develop. It's much better to approach any kind of, and I work on the mental health side, so that's my my focal area. But think of it more as trying to plant seeds, with the expectation that not every seed is going to germinate, get roots, and begin to grow, because there's a lot of different combination of factors that need to come together in order for that plant to grow, or for people to take action. So if you approach it more as, okay, I'm going to plant a seed here, let's see what happens. But then, if it doesn't sprout, well, I'll plant another seed, okay? And as long as you're setting the conversation up as one that this could be an ongoing type of conversation, and leave the door open for further follow-up, ask, would it be okay for me to check in about this? Because there's just so many things that have to come together for people to take action when it comes to your health and their health. And I think this will just be a much better route for something to eventually take shape.
My colleagues did a fantastic job of covering how you can support your student from afar when they're here in St. Louis. So I'm going to maybe close by how you can support while they're still with you at home, and that is to help and encourage them to please complete all of their healthcare requirements before they come on campus, by July 15th, actually, well before they come on campus, uploading those immunization records, doing their health history form. You'll find that our immunization upload is being rebuilt right now, but that will be back up fully functioning July 1st. They'll be able to see that their compliance status right there on the website. So encourage them to get that done by July 15th so we will have no hiccups as they move in. And then if you're planning to waive from the health insurance coverage, complete that by September 5th. And that is a very, very, very hard deadline. So please make sure that gets done. Just while I have you as a captive audience, that has to be done every year that you plan to waive out of your insurance. And if you forget, there's very little that we can do, and you'll have $2,000 worth of insurance that you don't want and probably don't need. So if you're planning on waiving out, make sure you hit those deadlines. Otherwise, if you have any questions, feel free to reach out to me throughout the summer. Happy to support as you guys get ready for this transition.
Dr. LeBlanc, Dr. Brounk, and Aaron, thank you so much again. Families, we hope you were able to learn some valuable information this evening. As a reminder, this webinar recording will be shared at families.woostel.edu next week. Stay tuned for our next webinar, a conversation with Student Financial Services, occurring on Thursday, July 22nd. You will be able to register for this webinar at families.woostel.edu. We'll see you then.